Today at the Central Health Region Conference Room, the Central Medical Laboratory of the Ministry of Health was gifted a thermocycler. The machine, although small, has the capability to test for bacteria and virus that causes diseases such as chikungunya, dengue, Zika, and other viruses in Belize without having to send samples abroad. The molecular testing technology will allow for better surveillance of outbreaks and planned public health responses. It is part of the U.S. government's major priorities in partnership with Belize and Central America.
The long-standing collaboration, partnership, and friendship between the Ministry of Health, CDC, the National Laboratory, and PAHO will continue to improve surveillance and research into these often debilitating diseases, which can adversely impact the health of residents of Belize.
The Center for Disease Control's Central American Regional Office is based in Guatemala, but the organization has been partnering with the country since the 1960s. In further explaining the function of the health equipment, Dr. Cornelia Cados Daniels of the CDC says that the organization continues to help countries to prevent, detect, and respond to health threats on its own.
A thermocycler, at left, doesn't look like much, but it's a very important tool for us. It's a machine that enables laboratories to conduct a scientific technique called polymerase chain reaction, or PCR. PCR is a technique that makes copies of a segment of the DNA of a virus or other pathogen. Over the past 3 years, CDC has invested approximately $550,000 US into public health programs in Belize. The CDC Central America Regional Office has worked with Belize since 2010 to build capacity of its local public health workforce through the Field Epidemiology Training Program, or FETP. This program trains local frontline disease detectives to identify, track, and contain disease outbreaks.
The equipment, which is valued at about $75,000, will be used at the Central Laboratory in Belize City. Director of Laboratory Services, Dr. Geraldine Morazan, says the impact on biological research is impressive.
With this technology now in the country, we will be able to test for arbovirus, like Dr. Arcados already explained, the dengue, chikungunya, and Zika, of public health importance, and also influenza, which will give us the opportunity to give a prompt diagnosis by detecting the presence of the virus, which will enable us to respond quicker. We will be testing for influenza. In the past, we have been testing in the Central Medical Laboratory with immunofluorescence method, but now with PCR, we will be able to be more sensible testing. We will be able to identify the different type of influenza.
Dwayne Moody for News 5.